Do you ever wonder why some kids start growing taller, developing body hair, or getting periods far earlier than their classmates? This early body change is called precocious puberty. It means the body's puberty clock has turned on at an age that is younger than normal, before 8 years in girls and before 9 years in boys. Think of a school bell that rings too early. The child is asked to join a class they aren't ready for. Understanding the why and how can help parents, teachers, and the children themselves feel more in control. Precocious puberty comes in 2 flavors. Central true precocious puberty. The brain's puberty button, the hypothalamus starts sending signals too early. Common triggers are brain tumors, injuries, infections, or sometimes no clear reason idiopathic. Peripheral pseudo-precocious puberty. The body makes extra sex hormones without the brain's signal. Causes include hormone-producing tumors like adrenal or ovarian cysts, certain genetic disorders, or exposure to external estrogen or testosterone, for example, creams. Contaminated food. Imagine a kitchen the body that starts cooking a cake hormones because the recipe brain's signal was never sent. The cake still appears, just from a different source. Kids with precocious puberty may notice. Girls, breast buds, pinkish underwear, start of menstrual periods, rapid height growth. Boys, enlarged testicles, facial or body hair, deepening voice, fast height gain. Both may feel emotional swings, acne, or sweaty underarms, just like typical teens, only much earlier. A simple way to spot it is to ask a child, do you feel your body changing faster than your friends? And observe growth charts at pediatric visits. Doctors use a step-by-step checklist. History and physical exam, measuring height, checking Tanner stage development stage. Bone age X-ray of the wrist to see if bones look older than the child's actual age. Blood tests, hormone levels LH, FSH, estradiol or testosterone, and sometimes MRI of the brain if central puberty is suspected. Treatment. For central cases, a daily injection of a GnRH analog, for example leuprolide, temporarily turns off the brain's signal, letting the child grow at a normal pace. For peripheral cases, treating the underlying tumor or stopping exposure to external hormones often stops the early changes. Sometimes anti-androgens or aromatase inhibitors are used. Parents can think of treatment like pressing a pause button on a TV that started playing too early. Because many triggers are not preventable, the best prevention is early recognition. Keep regular well-child visits, plot height on a growth chart, and talk openly with kids about any new body changes. Maintaining a healthy weight can also help, as excess fat can produce extra estrogen that may push the puberty clock forward. Avoiding unnecessary exposure to hormone-containing products, creams, certain plastics, adds another layer of protection. The last few years have brought exciting progress. Long-acting GnRH analog formulations now require only a few injections per year, improving comfort and compliance. Advanced MRI techniques can spot tiny brain lesions earlier, helping differentiate central from peripheral causes. Genetic testing has identified mutations, for example in the MKRN3 gene, that explain some idiopathic central cases, opening doors for personalized counseling. These advances mean doctors can diagnose faster, treat with fewer side effects, and give families clearer information about what to expect.